a lady that I knew a lady who knew someone who worked at a hospital. A friend of hers worked at a hospital, and it was through that her friend that I was able to get into a cardiac and stroke unit at a hospital. So that was my first hospital job ever since I got my first hospital full-time job, that I got since I graduated from nursing school. So that was how I was able to transition from home health nursing to hospital bedside nursing.
So when you were transitioning from home health, because home health is like totally, outpatient,
Yes.
how difficult was that for you to do the transition?
Very, like I said, very difficult. Because they expect you, like as an agency nurse, to know your stuff. So I was relying on my knowledge and experience from nursing school clinicals, and then I was asking a lot of questions, on the floor. So how do you let's say for instance, I made sure I asked questions though.
That's
to be
good.
Sure. I asked questions because I didn't assume that, I knew it, I would just go ahead and do it. Because I didn't want to make mistake and then put my license on
exactly
and at risk. Yeah. So if I wasn't sure of how something was done, I would ask.
Okay.
And I think that there were nurses that were there that were willing to show me how to, So that was what I did. It was very, very, very difficult. That it was so difficult that at 10 a.m., 11 a.m., I'm still passing meds. I'm still passing morning meds. It was a struggle.
Okay.
There was a time I went to the agency had sent me to one hospital. I don't know why I was supposed to be on the message floor. I don't know why they decided to send me to a PCU floor, which is the step-down unit. And they gave me a very critical patient who had a trach. And I don't remember if that patient was on the ventilator. I think he was on the ventilator. So I told them, I'm not comfortable with the ventilation, ventilator, thinking of a patient on a ventilator. They're like, oh, you don't do anything with the ventilator. The respiratory therapist does that. They handle all of that. I said, okay. So I thought it was going to be easy breezy, but no. Man, I was being called into that patient's room consistently for the entire shift. They kept calling me. The moment I stepped away, I think the patient had a seizure. And I don't know, every time the sitter would push the call button to call me back. And that was putting me, was setting me back on other things that I had to do for other patients. So the charge nurse was she knew that I was struggling. And then she just, went in there and took over the care for
the patient.
I remember vividly, if I can remember correctly, she ended up taking care of the patient for the entire shift. Okay. Because that patient was very critical, very critical. I don't know why they would assign that patient to me, because I honestly told them I'm a message nurse, but they said, oh, message and their excuse was message and PCU were on the same floor. Okay, I said okay, and then I went. They gave me a patient that was the acuity of a progressive care unit, not a message unit. Okay, so. She ended up taking over the care of that patient at the end of the day. And I was able to now focus
on your other patients.
But I saw that she was going in there very often. Every time I go up to that patient's room to do anything, she was like, oh, I already gave him his med. I already did that. And she was just taking care of the patient. And I just let her, continue taking care of the patient for the rest of the shift. While I focused on the others, the other ones that were less critical. So yeah, it was very challenging. Even when I eventually transitioned from home health nursing to when I got that full-time position at the hospital on that cardiac and stroke unit, it was still very challenging because being an experienced nurse, because I told them, well, of course I'm experienced, they only gave me 2 or 3 weeks of orientation. And they were going to let me start working on my own after the 3rd week. So at that point, I didn't feel comfortable being on my own. and they said they could only extend it for another 2 weeks. So giving me an orientation of like 5 weeks altogether. So after the 5th week, I was on my own, whether I was ready or not. So those first few weeks of being alone on the floor were very challenging. I remember coming home and talking to my friend at that time and saying, "Hey, I'm about to quit this job. I need to know that I can put my license at risk, you know." But I'm glad I did not quit.
Good.
I'm glad that I stopped going, because that was how I was able to build my confidence. I was able to build, to build my stamina, you know, and be able to work independently as a nurse. Because if I had quit at that time, I don't think I'd be able to thrive and be successful as a nurse. So at that point of giving up, whenever you encounter or whenever you're faced with a challenge and you feel like, hey, I want to give up at this point, don't give up at that point, because
push a little harder.
Once you pass that phase, once you break through, you're going to get better, you're going to be more comfortable, and you're going to be much more competent.
Exactly.
So, yeah, I think everybody has that phase where they feel like they're at a crossroad as to whether to continue nursing or to quit the profession altogether. So when you get there, don't quit.
That's
Keep
so
pushing.
true.
Yeah.
And then the one thing about it is that, you know, with you or with anybody, once you identify your strength and your weaknesses, if you know something you definitely is not comfortable with, it's always good to, you know, speak up, or, you know, at least just say something to somebody. And it was a good thing your charge nurse was able to step in and help you, because a lot of times, sometimes, you know, persons tend to struggle with all of that, you know, not being able to speak up whenever they are not comfortable with something, or if it's a case where their charge nurses are there, sometimes they let them just, you know, continue with whatever they're doing. So it's nice that you were able to have that kind of support from your colleagues there. In terms of your ratio for your assignments, what is that usually like? And do you normally find that you have a lot of assistance depending on the facility you're working at?
So when you're talking about, because I found that each hospital that I worked at had different patients to nurse ratio, right? So that facility where I eventually transitioned to, you know, from home health, at the start it was 5 patients to 1 nurse.
And that's on the med tele? That was the med surge or med tele?
Yeah, it was a med surge floor.
Okay.
Yeah, but they dealt specifically with cardiac patients and stroke patients. So it was 5 patients to a nurse.
Okay.
So at first it felt like a lot. Like I said, it was because I didn't have prior experience. So initially it felt like a lot, but after some time I got used to it. So it felt I was able to now manage that workload.
Yeah,
So when I left there, so I do have that, and then I eventually transitioned to the PCU floor. So with the PCU floor, it was specifically cardiac PCU as well. Okay, so when I transitioned to a cardiac PCU, I've heard so many other people like that work at different hospitals that a PCU floor usually have like 4. Is a patient ratio of 4 to 1, so 4 patients to 1 nurse. But on that floor, we still got up to 5 patients.
Wow.
Even though it was a progressive care unit floor and it was cardiac, sometimes we had LVAD patients, which is the left ventricular assist patient with the left ventricular assist device. So we still had up to 5 patients on the floor. I don't think there was ever a time. I'm talking like this was a different hospital now. Different from that hospital that I went to from home health.
Okay.
So this was a different hospital, because I left from there, because I spent about 3 years at that hospital. You know, I was able to like get my feet wet and get very comfortable. I was now confident that I could, you know, work independently and be able to like transition to something much more critical. So I went to like a cardiac PCU.
Okay.
And then we had LVAD patients. Sometimes we had patients with swan guards. And then so it was at that floor that we, like I said, we were supposed to have a nurse, no more than 4 patients, right? But there was never a time that I worked there on that floor that I had less than 5 patients in a shift.
Okay.
With the LVAD patients. And if you know LVAD patients, you know that those are very critical patients. A lot of them are on Mironol drip, like long-term Mironol drip. They even have the Mironol drip at home. So even with that, even though we were taking care of very critical patients that were that critical, we still didn't have less than 5 patients.
Okay. At any point you felt as though, your license were at risk? And
no, I didn't feel like my license was at risk. I felt like I was comfortable doing it. Do you understand? Even at that point, I didn't complain. It was not just me. Everybody else were doing it, so I couldn't be the only one complaining. Do you understand?
Yeah.
So if other people are okay with it, so why should I
Why
say
should
anything? You understand? So like other people are doing it, so it's like the norm here, okay. So
you just get into...
And then you adjust to it.
Yeah, okay. Did you have to do any special like training or courses to work with those kind of patients, or you just do your regular RA and get your experience and that was it?
No. I worked there for exactly 1 year. It was in a different city. It was in Temple. So I worked there for 1 whole year. And then before coming back to Dallas.
But with the LVAD patients and your other critical patients in the PCU, were you required to do any certifications, or you just work as a regular RA?
You had to attend an LVAD class. Yes.
Okay.
You have to get the you have to be certified in taking care of LVAD patients before you can take care of those patients. If you've not attended this class, if you've not got your certification, they would not assign those patients to you.
Okay.
Yes.
Okay. So apart from the med-surg area, have you worked, and the cardiac, the PCU, have you worked anywhere else?
I've worked cardiac. I worked general, like a general PCU.
Okay.
Because when I left there and I came back to Dallas, I joined the float pool team at the hospital. That I got an employment with when I came back to Dallas. I was on the float pool team, so I was literally working everywhere. I've worked telemetry. I've worked rehab. I've worked epilepsy floor. Neuro, and then I've worked a variety of floors, urology as well. Trying to think of what other floors. Yeah.
Okay.
So just more, but mostly like that's considered med-surg, and then telemetry. It's the reason why telemetry is different is because you have to be able to read and interpret different heart EKG strips. Yeah, be able to interpret them and read them and be able to take action whenever you see a rhythm that is abnormal.
Okay, nice.
Be able to identify when a patient goes from normal sinus rhythm to AFib or normal sinus rhythm to A flutter, and be able to do something, or to VTAC, like whenever there's a change from something that is their baseline to something that's much more dangerous, I would say. You should just think that, okay, that's fine. You should be able to take action, Yeah. Because every 4 hours they print out the strips for this patient, and then you have to interpret them and then do the measurements of each, like do the measurement, the calculation and everything, and then sign it and then put it in the patient's chart.
So the nurses do that, or do you have like a telemetry?
The nurses are the ones that do it. Yeah.
Okay, nice. So you seem to be working under like a lot of environment that is like we would consider to be high pressure situations. How do you normally like stay focused under that kind of environment?
So how am I able to function under such environment?
Or just to stay focused? Because if you're working with like your LVAD patients and you're having to do your EKG, monitoring and reading and all that, how do you kind of stay organized or stay focused throughout your shift?
Okay, you have to do first things first. After getting reports, while they're giving you report, you'll be able to tell which patient is higher acuity and which ones are of not so high acuity.
Okay.
So the ones that are very sick, according to your assessment according to what you've heard during the report, the ones that you kind of like save to be seen last. And then the ones that according to your assessment, like this is just during the report. So based on what you've heard, you've not even gone in the room yet to see them, based on what you've heard, you now know how to arrange them. Okay, you see the ones that are very sick first, and make sure that the parameters that needs to be monitored, especially if they're connected to like to a monitor. You know how they have a monitor in the room? If they're connected, then make sure that the parameters on the monitor tallies with the parameters on the order.
Okay.
So that, because if anything goes wrong for the patient, the alarm is going to go off. So once you hear the alarm, you just make sure that you stay alert, listening for this alarm. And then whenever this alarm go off, you have to make sure you stop whatever it is that you're doing and go attend to that patient.
Okay.
So I see the critical patients first and make sure that they're stable, stable to the point where I feel like, okay, I have time to go see the other ones that are not so sick.
Okay.
So, yes. So, by the time I'm done with all of that, I come back. We're in the nursing station. Those ones, if I have like really, really sick patients, I end up doing my charting and documentation in the room.
Okay.
And mind you, yes, I do my charting so that way I'm not missing anything.
Nice.
Because you could be charting outside, and people think that, oh, you're sitting down there, you're not doing anything.
Exactly.
And they come putting so many demands on you. So, you know that. You know what I'm talking about. So, to prevent that, I do my charting in the room. So that way, I'm eyeballing my patient, and what I'm charting, I'm sure of what I'm charting. I'm not like, oh my God, did he have a wound? Where was the?
Then you're gonna have to try and figure out.
Procedure site. Was it the left brain or was it the right brain? No, you don't have to ask yourself that question. You're in the patient room. You can take a look and say, like, okay, can I take a look at your procedure site? And then you know for sure what side it is that you're charting. Because some people, when you go back and look at some people's charting, when the procedure side is actually the right, but they'll chart the left.
On the left.
It was done outside of the room.
Exactly.
So to prevent all of that from happening, I chart in the patient's room.
Exactly.
And make sure that, that helps me to chart much more accurately. And we have our phones with us at all times. The iMobile phones.
Okay.
So if anything happens, our patient calls for anything, it rings on our phone, or if it doesn't ring to our phone, the charge nurse or whoever that answers the call light can relay the patient's needs to you.
Okay, nice.
So while you're in there taking care of that patient, if your phone is not going out, that means the other patient for right now is fine.
Are doing
so
okay.
By the time I'm done attending to this patient, even then and they've all set it down, then I can go to the next patient. So I start seeing my patient from the one that's
most
from
critical.
The sicker patient to the one that is not so sick.
Okay, nice.
Yeah.
Okay. So, nurses tend to work long hours. Our shift is, our work is usually very demanding. How do you manage your work-life balance? How do you manage that?
My work-life balance, that's one thing. I'm a very family-oriented person, and I found that I love spending time with my family. So the days that I'm off, I don't work overtime. I don't pick up extra. I'm telling you, I don't pick up extra shifts. I just do my 3 12-hour shifts in a week, and the rest of my week, I'm home with my family.
Nice.
Home with my children. Yes.
How many kids do you have?
How
many kids do you have?
I have 2.
2? Okay, nice.
Yes. I'm home with my husband and my children, and we can watch, just have a family time, together, watch TV, maybe go out. If my husband is not around, or if it's the day that my husband goes to my kids goes to school, I mean, we can do that after they come back from school. But I just make sure that the days that I don't need to work, I don't work. Okay. And I'm present for them. I'm able to cook dinner for the family, able to spend time with my family, able to do things, like go out, go to the restaurant, and just do something fun for the family. So that's how I'm able to manage work and
your
life. That's how I'm able to ensure a balance between my work life and family life.
Okay.
Yeah.
Okay. What is like one important skill that you think every nurse should possess, or what is the most important skill that you have that you bring to the field of nursing?
So I think you should have a critical thinking skill.
Okay. Mm-hmm.
You should pay attention. As if you want to be successful as a nurse, you should be a critical thinker and pay attention to detail. If you're a critical thinker and you pay attention to detail, if a patient is changing, or if a patient's condition is changing, you can catch it at a very early stage before it deteriorates to before it gets really bad.
Exactly.
You can catch it at an early stage and take action, intervene at that point before it gets really bad. Because you're paying attention to detail. You're like, oh, let's say for instance, you walk into a room and the patient is there for like respiratory issues. You go in there, you did your assessment, the patient is breathing normally, the breathing is normal, everything is good, sats are fine during your assessment, and you come back like an hour later to give medication, and you can tell that the patient is having like an increased work of breathing. It might not be so bad yet, but you can already tell that it's getting worse. Even though it's not bad yet, it's not as it's not like it was when you first came in and did your assessment. At that point, you should start doing something to prevent the condition from getting worse. So that is the attention to detail that I'm talking about. But if you're like, even though his heart is still fine, even though his work of breathing has increased, you're like, oh, his heart is still fine. I'm going to monitor him for a little bit longer. No. At that point, if he has pure and albuterol, call for it. Let him give it to the patient, but so that patient does not get worse. Don't wait until it gets really, really bad for you to intervene.
Exactly. That's so true.
Yeah.
Okay.
That's what I would say. And be able to think critically, like just know your patient and be able to patch them whenever you feel like their condition is deteriorating.
Okay.
Be able to catch it early enough.
That's so true. That's so true. Tell me about one of your most memorable or like an impactful moment you've experienced in your nursing career.
My most memorable moment in my nursing career, I would say, was when I took care of this LVAD patient, right? It was when I worked at Temple. This lady, she normally, we as nurses, we go in there, give them the medication, and we zoom out of their room. If they want to call, if they need anything, then they call us, we attend to that particular need, and then we'll leave.
Yeah.
There was this particular patient of mine, right? I noticed that she was so quiet. When you ask her questions, she just answers the questions to this, and it just answered straight to she answered the question directly, and she just keeps quiet. But with time, I started to talk to her. I would, like, whenever I'm done, like, there was this time I went there to give her medication. I started talking to her about her kids, her family, and then she's like, well, I don't have any kids. I said, oh, okay. But like, and then she told me, I only have a dog.
Okay.
That's my life and everything. And then that's how I found out that she was married, and she's married, and then she and her current husband don't have kids together and everything. And I found out that the reason why she was so quiet was because she really loved to talk. She loved and enjoyed company, but it seemed like the nurses were not there to give her that. You understand? They just come in, give them medication, do the assessment, and they're out. Yeah. But the more I spoke to her, the more she opened her, the more she got chatty with me. I'm like, wow. So whenever I was done with everybody else and I'm done with my charting and I had downtime, I would go to her room to go chit-chat with her. Okay. And then when my phone goes off, she'll be like, okay, make sure you come back when you're done with everything else. Yeah. I'll say, yes, I'll be back. I'm done with everything, like when I'm done with, none of my patients needs me right now. When I'm done with that patient, I'll be back.
Yeah.
Like, okay, I'll be here. And then lo and behold, she wouldn't go back to her bed. She sat on the chair.
Because she's waiting on you.
She wouldn't go to her bed. She'll be there waiting for me to come back to continue to teach her with her.
Okay.
That was more than just the nursing care, more than the medication we were giving, more than the written plan of care for her. It was something outside of that. She needed like that companionship with someone. Nobody visited her. Her husband had a job that kept him from being able to visit her, and her dog was not. They were not able to bring her dog to her, so she was kind of lonely. For she needed somebody to interact with.
That's so true.
That was why whenever I stepped away from there, she asked me, "Make sure you come back when you're done with other patients." And she enjoyed my company, and I made sure that since I promised that I was going to be back after attending to my other patient, I made sure I kept to my promise and I came back. So that we kind of built a relationship. Unfortunately, I think I was off from work for some time, and then I later went back to work, and I was told that she passed on.
Oh my. Well,
that really, I felt that her passing really affected me because of the kind of like relationship that we had built. But I was glad that I was able to, help
the conversation
a little bit more during the last phase of her life here on earth. Yeah,
that's so true. And that's what I always tell people, like, yes, nursing, we tend to only seem to be looking at the physical aspect of, when we go in and see the patient, but it's more than that. You have to look at the patient as a whole, meaning you look at the physical, the emotional, the spiritual, psychological, all those aspects of the patient, and make sure we address it. It's not necessarily just walking into a room, giving medication, and then out. We need to kind of dig a little bit deeper, because sometimes some persons have some issues that are contributing to why they're admitted in the hospital, so it's always nice for us to give that extra, second, or just talk with the patient a little bit to find out how they're doing. That's so nice.